here at St. Mary's, you've done an outstanding job during a very difficult year. Frank told me that you've had incredible fluctuations in your census, which has meant that you've opened your contingency unit 6 West 3 times so far this year. I appreciate your flexibility in keeping the needs of our patients as your first priority. And I'm well aware that every day, every shift, every hour, you are paying attention to resources to meet the needs of patients. And I want to thank you for being such good stewards of our resources. And on top of that, you did willingly share excellent ideas about how to reduce expenses. And many of your ideas resulted in significant cost savings. I also know, this is other good news, in May and June, your patient willingness to recommend, those scores were in the 96th and the 94th percentile, respectively. That is really awesome. And this is another good news. In addition, you reduced your door-to-doc time in the ED to 23 minutes. And if that's not a record in the system, it's pretty darn close. That is really exceptional. And you were recognized for exceeding quality goals in 4 areas in the CMS Premier Demonstration Project. Those are acute MI, coronary bypass, hip and knee, and pneumonia. And because your quality is so high in these areas, you're going to receive more than $61,000 for those performances. That's extraordinary work, and I congratulate you for that. And then many of you worked very hard to open the only freestanding ER in Wisconsin on schedule July 1st. And patient visits have exceeded projections. The Sun Prairie community has embraced St. Mary's, and this project is a wonderful example of community collaboration. Now, at St. Mary's Care Center, you've done some innovative things to reverse your declining average daily census. Your marketing campaign focused on the fact that you received the Governor's Forward Award of Excellence, and the resulting press coverage and public relations helped increase the demand for your services. Then, you made it easier for patients to be admitted by removing bottlenecks, and you're now able to admit 8 to 9 patients a day. So as a result of all of these changes, you have a higher overall census, including more high reimbursement short-term rehab patients. What that meant is one of the best financial years that you've ever had for St. Mary's Care Center. And considering what's going on in the economy, this is very good news. So congratulations to the Care Center. And let me just mention a couple of other things, because I'd be remiss if I didn't acknowledge 2 Franciscan Sisters of Mary. Sister Priscilla Weber is celebrating her Golden Jubilee this year. That's 50 years as a sister. And Sister Mary Ellen Lewis, who retired from St. Mary's once again. I don't know, is that her 2nd or 3rd retirement? Sister Mary Ellen is now a volunteer here, so please join me in thanking them both for their many years of service. You know, as I was thinking about what I would say to you today, it occurred to me, I'm very interested in why you choose to work here. Do you think of this as just a job? Or did you make a conscious choice to be in healthcare? And are you here at this place for a specific reason? Maybe it meets some need within you. Maybe while we have a brief moment during the reception, some of you will be willing to share your thoughts with me. But I thought I'd spend a few minutes explaining why I'm in healthcare and why I am the way I am, which I'm sure is a mystery to many people. But I promise it won't be my entire life story. That would be very long indeed. When I graduated from high school, many, many years ago, there were very few career choices for women. You could be a secretary, but I couldn't type, so that was out of the question. Or you could be a teacher or a nurse. My family didn't have enough money to send me to college to be a teacher, so I chose nursing school. And since I was living close to here in Cuba City, I came here to St. Mary's to attend school. And frankly, my experience there changed my life. Not only were those 3 years among the very best of my life, where I made friendships that I have to this day, but I was taught by women who were absolutely amazing, the sisters. Those nuns were strict, the work was exhausting, and the studies were hard. But what we discovered as students was that we shared something in common. We hadn't understood it when we started school, but we realized it as soon as we began to care for patients. And that was, we all had a deep desire to help people. We weren't in nursing for the money. We were in it to be of service to people in need. As students, we entrusted ourselves to the nuns, and those fine women not only exemplified the finest aspects of the profession, but they helped us realize our own potential. The sisters taught us competence coupled with compassion, discipline tempered by love, and knowledge sharpened with intuition. And above all, they imbued us with a deep and lifelong respect for the people that we served. They taught us reverence for our patients and for our ability to help people heal through our words, our touch, and our actions. And we learned about healing in the truest sense. Cure the patient whenever possible, but always, always care. We went to St. Mary's, came here to St. Mary's as ordinary people, and they made us extraordinary nurses. They called for something in each of us that we didn't even know existed. And my nursing school experience helped me find that spark within myself. Some might call it the spirit. But that energized me and made me want to make a difference. And that discovery shaped my life in ways that I could never have imagined. Well, the first thing was that a year after I finished nursing school, I joined the congregation that we now know as the Franciscan Sisters of Mary. I was so taken with those sisters that I wanted to be part of them. The congregation pushed all of us to continue our education, and so soon after I joined, I was sent back to school to get my baccalaureate degree, and then later my master's. And as I moved into various jobs within SSM Healthcare, I constantly sought to make a difference, constantly sought ways to make care for our patients as good as it could possibly be. Through the years, I assumed executive positions with SSM Healthcare, and in 1986, when all of our facilities came together as a formal health system, I became the first president and CEO. It was then that I began to look at things from a different perspective. In my previous roles, I had focused on my immediate job rather than on the big picture. But when I assessed our system from the perspective of CEO, I saw an organization that was only slightly better than average. And that was completely unacceptable to me. The sisters' teachings had made me aware of the potential that each individual has for greatness. As the CEO of SSM Healthcare, I looked for that same potential for greatness within our large and complex organization. And that's why I push you so hard. Because I know each of you is capable of great things, and I believe that our patients deserve the very best care that we can give them. See, the thing is that in an organization as large as ours, with 23,000 plus people, although everyone has the best of motivations, it's essential to put in place systems that will ensure exceptional care to our patients. And that's why we have goals, and that's why we have posters, and that's why we have passports. Because all of these things map out the specific and measurable things that we can do to bring us closer to exceptional.